Good evening and welcome to the 6 p.m. City Council meeting for Tuesday, February 23rd, 2021. Let the roll call reflect that all council members are present. Just for point of reference, we read the chair's the council chair determination to hold electronic meetings without an anchor location. We read that at the beginning of the work session, so that has been read and is on the record. Moving forward, we'll go ahead and start with our Pledge of Allegiance, and we've asked Vice Chair White to go ahead and lead us in that.
Thanks, Chair Blair. Please rise if you are able. Please repeat after me. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Thank you.
Thank you, Vice Chair White. And now we ask all those in the meeting to join us in observing a moment of silence. Thank you. Before we begin, we do have a change to the agenda. We are actually going to go ahead and remove the item listed under common consent to get a little more information and bring it back at a later date. So could I get a motion to go ahead and remove that?
So moved. We remove common consent item A from the agenda.
I second.
Thank you. We have a motion from Councilmember Hire and a second from Councilmember Lopez to remove the items listed under common consent. This is a voice vote. All in favor?
Aye.
Aye. Any opposed? Thank you. That passes. And we'll bring that back at a later date. First, we have some recognitions. We have the COVID Memorial Day. And we've asked Councilmember Lopez to read that for us.
Okay, so my apologies. I had my screen up here with what I needed to read and I lost it. So if you give me a second, please. Let me try to find it. I have too many screens open. Okay. Okay, so this is COVID Memorial Day. Is that right, Chair?
Correct. Yes, correct.
Okay, thank you. Okay, thank you for giving me this opportunity, declaring March 1st, 2021 COVID-19 Victims and Survivors Memorial Day in Ogden City. Whereas the COVID-19 pandemic has taken a significant toll on individuals in our community and people throughout the world, the first Monday in March has been designated as COVID-19 Victims and Survivors Memorial Day to commemorate and honor individuals impacted by this infectious disease. And whereas COVID-19 is an illness caused by a virus that can transmit from person to person and has spread across the world, creating a global pandemic that is having catastrophic effects on human life, our community, and our economy. And whereas local and state governments, health departments, and public servants have taken bold actions to protect residents, support struggling local economies, and find innovative ways to provide services. And whereas in response to rapid spread of COVID-19 and stay-at-home orders, essential workers have stepped up to provide critical services to help protect our communities and save lives, sacrificing their own health and safety. And whereas COVID-19 has had a disproportionate impact on low-income communities and communities of color, exacerbating inequities already prevalent in our system that we must address as a community and nation. And whereas public health guidance and policies targeted at prevention, such as social distancing and wearing masks in public, staying home, and receiving a vaccine help mitigate the spread of COVID-19, prevent illness, and lessen the burden on individuals and society. And whereas more than 2.4 million people worldwide and nearly 500,000 in the United States have lost their lives due to COVID-19, in Weber County, more than 150 lives have been lost to this deadly virus. And whereas each life lost to COVID-19 matter and leaves a hole in the hearts of loved ones, family members, and surrounding community. Now, therefore, be it resolved that the Ogden City Council and Mayor Michael P. Caldwell hereby proclaim March 1st, 2021 as COVID-19 Victims and Survivors Memorial Day in Ogden City. We urge all citizens to remember those who have lost their lives and those who continue to suffer from the impact of the virus. We encourage our residents to continue to take preventative measures such as social distancing, wearing masks, and following public health orders to help prevent the spread of the virus. We express our deepest gratitude to the healthcare workers in our community who have been on the front lines throughout this challenging time. Thank you, Chair.
Thank you. Do you want to go ahead and make a motion?
Oh, absolutely. I'll make a motion to adopt this resolution, Chair.
I second it.
Great. We have a motion to adopt this joint proclamation by Councilmember Lopez and a second by Councilmember Stevens. This is a voice vote. All in favor?
Aye.
Aye.
Any opposed? That passes. And I believe we have representatives from Intermountain Healthcare and Ogden Clinic joining us tonight. I'm not sure.
Donna Chapman is on the panel. She's from McCady.
Hi.
Hello. Thanks for
Hi.
being here.
Thank you. Thanks for the invite.
And it also looks like Ken Whipple's here from Ogden.
Okay.
Hi, thank you for having us.
Do either one of you want to say anything?
Yeah, I was gonna actually, do you mind if I say something really quick? Usually this is kind of an unusual recognition in that many times we're all in person, we would have a big applause and we would shake all of your hands and we would take photos. And so it's just a little bit different in this format. It doesn't seem quite as pronounced, but we do appreciate you being here.
Thank you. I really appreciate the invite. McCady has so far treated just over 1,100 COVID patients, and we've lost just under 100 patients. So we've had 100 patients pass away. And the impact on the families that we see, the impact on the caregivers, it's pretty significant. I'm really proud of our team that stepped up to their litmus test was how can we provide care to the community that we're serving? And I'm proud of the team that they were able to do that. We do continue taking care of COVID patients, and we're now venturing into providing vaccinations for the community. And starting next week, we'll have a community vaccination clinic 3 to 5 times a week. So appreciate the recognition that COVID has had a huge impact on the community, both those who are survivors or those who have had loved ones pass away. It is, this virus is significant. And we did pass an unfortunate milestone today in the U.S. where we now have over 500,000 deaths nationwide from COVID. So it is a pretty serious disease, and I appreciate the significance that the council is giving this disease and the appreciation for the frontline workers that are battling this disease on a daily basis. So thank you.
Thank you, Donna.
Yeah, and I would echo everything that Donna said. Before they end up at McCady or before they end up at Ogden Regional or the other hospitals in the area, they usually come to one of our clinics, either an Intermountain clinic or an Ogden clinic or another clinic in the area. And we've tested nearly 60,000 people since July, and our employees have been out in the rain and in the wind and in the snow, testing people in their vehicles or testing them in tents that we've set up outside to try and keep us and the other patients safe. And it's been a heavy lift for our organization and for healthcare in general, in Ogden and the state and throughout the world, as I'm sure you've seen on the news. And I'm very thankful for the recognition that we've received here tonight as healthcare workers. I'm very proud of our healthcare workers, our providers and employees who work every day for the benefit. And we are so encouraged by the work that's being done from a vaccine standpoint, as well as from the decreasing numbers that we're seeing in our community and throughout the state. So thank you again. It's truly an honor to be here and to hear the recognition. So thank you.
Thank you, Ken.
Can I ask a question?
Sure.
I'm curious if either one of you are aware of, or maybe there's no data to share, but COVID not only has affected people because they've gotten the disease, but there's affected a lot of people that because of the treatment, the cure that we've instigated. And I wondered if either one of you have any data that you could share with respects to the increased suicide numbers or the domestic violence numbers or anything like that is also an effect from this disease. Either one of you have anything about that?
I don't have specific data around it. Anecdotally, absolutely. Our behavioral health units are full. The isolation that this disease causes is significant and it's real. We have heard that domestic violence is up because people are spending a lot more time together than they're not used to doing that. There's also patients in hospitals that don't have visitors because of COVID. You're COVID, you don't get a visitor, and that isolation is also a problem that we deal with.
Yeah, and I would have to agree with Donna. I don't have any data other than what we've experienced from our employees and our providers. They're tired. They have worked very hard. Our urgent cares, which are normally pretty busy at this time of year, last month they were 200% of normal, and they're having patients in their 20s pass away, and that's very discouraging. And they've had many more patients pass away once they get to the hospital than they're used to at all in their careers. Typically in primary care, we're treating very acute minor things, and to have some of their patients, some of their favorite people who they've treated over many years end up in the hospital and passing away has been very hard on our healthcare providers. And I'm worried about long-term effects being provider, physician, PAs, nurse practitioner burnout from this. But as far as specific data, I don't have any, just anecdotal things like Donna said.
I can comment on that if you don't mind, Councilmember Heyer.
Anybody that's got information is great.
Yeah, we've been monitoring as a system this issue very closely, and certainly rates of mental and behavioral health needs have gone up exponentially. We're also really concerned about how long this will continue to impact people in the future as well. But the suicide rates in Utah specifically actually have not increased. So we're really, really appreciative and happy about that. We just know that there could be some long-term effects, and we don't know if that will stay this way. But so far, we're doing okay as far as the data I know about.
Thank you.
We'd like to lower it, at any time, I should say, but it hasn't increased.
I think we would probably have to talk to law enforcement about domestic violence rates and things like that. They'd probably be the ones that would have that data. But, I just know that this has hit a lot of areas of our society, some indirectly to the disease, and, that have to do with the policies that we have. And I hope we kind of crunch those things and find out what those things are so we can maybe address some of those issues if this kind of a thing happens in the future.
Chair, I have a question. Wondered if going forward, if our healthcare process is going to change into being a new normal aspect. What we did before is surely not going to be the same as what we're going to do moving forward.
Donna, would you like to go first, or do you want me to answer?
I can go first. I think there was always a plan to move services to a teleplatform. This certainly escalated the timeline. And a lot of the teleplatforms that we're currently using for physician visits or even urgent care visits through Connect Care, that isn't going to go away. I think we'll continue using those platforms. So that's one change in healthcare we've seen, and I don't see that going away. I see more platforms coming, even more platforms coming. So for behavioral health, for oncology, things like that. It's been pretty convenient for patients to be seen while they're sitting in their own homes by a physician and only coming into a facility if they need to.
Yeah, I agree with everything that Donna said. I'm an operations guy at our clinic, definitely focused on ways to be more efficient and safer and better. And everything Donna said about telehealth, I think our insurances are realizing that we can perform telehealth visits safely and accurately from a medical malpractice standpoint. And I'm glad that this has hopefully opened their eyes to reimbursing us for telemedicine and telehealth visits. I think you're going to see a huge increase in televisits, especially in behavioral health and neurology and things like that, where we really don't have to have the patient right in the same room with us. We've also gotten better as an entity. I think we're going to have a lot more of our employees work from home, which will help with pollution, which helps with expenses on the overall healthcare system. If you don't have to have as large of office space or anything like that, you can obviously reduce your expenses. And so I think those things are going to be really great things that come from this. Also, too, I think you're going to see a lot more where we check patients in vehicles outside and they can wait. Healthy patients can maybe wait in their vehicles while we bring sick people into the waiting rooms or vice versa, which before that was kind of an unheard of thing that we were considering. So those are things that we've noticed that probably will stick. And you'll probably see a lot more mask wearing long-term from patients who come in and they're sick, and that might help contain infection in waiting rooms and things. So those are just a few things that we've noticed that we're thinking are going to stick long-term.
Great question.
Chair, I just want to also mention that Dr. Catherine French Fuller at Weber State and her team has done, they're actually putting a dashboard together. Councilmember Heyer, you had asked, and I just pulled it up, but the dashboard covers a variety of topics from economics to domestic violence to health, and it's centered around just Weber County. So I'll send that out to you guys. But I just want you to know that there are people within our community that are looking at that kind of data, including Intermountain Healthcare. So I didn't want to. It's very specific to Weber.
Thank you. Any other questions or comments? Well, thank you, Ken, and thank you, Donna, for being here, and thanks for all you do for our community and keeping us safe. So thank you both.
Thank you. I appreciate it.
Yep.
Thank you.
Okay. Next up, we have a joint proclamation declaring March 2021 as Women's History Month in Ogden City. And we've asked Councilmember Chaburka to read this for us.
Yes, and I'm happy to do so. Thank you so much. And I believe, did you already say we have Katie Nelson here? I apologize. I was reading something else. This multitasking is challenging. Well, welcome, Katie. Thanks so much for joining us. So let me go ahead and read this. Declaring March 2021 Women's History Month in Ogden City. Whereas Ogden owes much of its success and growth to the contributions of women, their influence has been invaluable, and through their service, hard work, and dedication, they have have and continue to enrich our community. And whereas in 1980, President Jimmy Carter issued the first presidential proclamation declaring 1 week in March National Women's History Week. 6 years later, Congress extended the week to a full month of celebration. Each year, the president issues a proclamation declaring the entire month of March Women's History Month. And whereas the success of our community is built upon the hard work of men and women, all too often the contributions of women go unnoticed. Women's History Month honors these women and recognizes their contributions to history, society, and culture. And whereas the National Women's History Alliance 2021 theme for Women's History Month, Valiant Women of the Vote, Refusing to be Silenced, celebrates the women who have fought for the women's right to vote in the United States. This is a continuation of last year's theme, which recognizes the centennial of the 19th Amendment. We honor women from the original suffrage movement, as well as 20th and 21st century women who have continued to ensure voting rights for all. Their positive impact has helped shape Ogden into the city it is today. And whereas last year, the Weber County Heritage Foundation honored 3 Ogden women who were central to the women's suffrage movement by placing historical markers around the city. Sarah Anderson, elected 1896 as Weber County's first female legislator. Jane Richard, the National Relief Society delegate at the National Council of Women meeting in 1891. And Kate Hilliard, the first woman delegate from Utah elected to attend a national political convention in 1896, were all early pioneers who helped pave the way for the future generations of women. And whereas we commemorate all of the wonderful women of Ogden, past and present, their lasting impact and influence will forever be a staple in our community. Now, therefore, the Ogden City Council and Mayor Michael P. Caldwell hereby proclaim March 2021 Women's History Month in Ogden City. We express our sincere appreciation for the great women of our community. We recognize the efforts of the Weber County Heritage Foundation, the Junior League of Ogden, and all other organizations within our community who make Ogden a great place to live. So, Chair, I make a motion that we adopt this proclamation.
I second.
Thank you. Thank you for reading that, Councilmember Chaburka. And we have a motion to adopt this joint proclamation declaring March 2021 as Women's History Month by Councilmember Chaburka and a second by Councilmember Lopez. This is a voice vote. All in favor?
Aye.
Aye.
Any opposed? That passes. Thank you. And as you mentioned, we have Dr. Katie Nielsen from the Heritage Foundation, and it looks like Jessica McCowan, the Junior League President-elect is.
Jessica, I'm so sorry. I didn't know you were on the call. Welcome. It's great to see you.
Thanks.
So we'd love to hear from both of you if possible.
Do you want to go first, Jessica?
Sure. First of all, we just wanted to say the Junior League of Ogden is so honored and grateful to be a part of this proclamation. The mission of the League has been focused on the needs, interests, and development of women in Ogden for over 100 years. So we are absolutely thrilled that not only do we live in a city, but we have a city council and mayor that would take the time to acknowledge Women's History Month, but also actively celebrate that legacy of impact and influence. As we move into March and follow along that theme of valiant women for the vote, refusing to be silenced, we're excited to not only encourage the research of women's history, but also take the time and opportunity to engage and educate the coming generations, to utilize their voices, to be heard, and to hold up that legacy laid out before all of us. We are so grateful for this proclamation and for your celebration and your individual continued focus on a strong, healthy, and equitable future for all of the women in Ogden. That's all.
Thank you.
I would just echo 100% of what Jessica just said. Amen. Amen and hallelujah. I think it's really wonderful that we live in a city that acknowledges Women's History Month and that we have such a rich history here to draw from. And one of the things that the Heritage Foundation has been doing over the past couple of years is just unearthing those women's stories. They often just fall through the cracks when in previous historical narratives, assumptions were made that certain types of people change history and everybody else is just kind of the supporting characters. But now we know it's not the case at all. And so we have been digging up the stories of these women. And as was said in the declaration, we were really pleased to put 3 Ogden women on the National Votes for Women Trail. There are only 5 per state, and Ogden got 3 of them. We were very thrilled to outdo Salt Lake City. Pretty much anytime we can beat them, we feel extremely proud. So we do have the markers from the forge, and they are these really large iron painted signs. They look really beautiful, and the ground was frozen, so we had to stall actually putting them up. But now that the ground is thawing, we're hoping to celebrate this March with a virtual probably event, actually putting those posts up. One of them is going to be right downtown in the junction, like pretty much right in between the Solomon Center and the hotel. Right there, that was Sarah Anderson's house, where she left to cast a vote in Ogden, even though it was illegal. And she walked 2 blocks down the street to the spot that's now the Salvation Army, and that's where she attempted to register to vote. She was turned away because she was a woman, and she sued. And another point of Ogden pride, the case went to court in Ogden, and the judge ruled that Sarah Anderson and all women do indeed have the right to vote. It was appealed to the Salt Lake court, and that judge struck it down. And the other 2 are on private property. One's at the Daughters of Utah Pioneer Museum, because that was Jane Richards' headquarters, and another one is at a house on 26th Street. If anybody has any tips for how to navigate the red tape that is required to put a pole in the ground in the junction, I would love any advice. We've been attempting to put this pole in the ground for 6 months to no avail. So I know you guys are the experts. So if anyone has any tips, I'd love to hear them. But thank you so much for your support. And I hope that we just can keep building on this momentum and celebrate the incredibly diverse and fascinating history of the whole of Weber County.
Thank you both for being here. Any questions or comments for either?
Well, I'll just say I really appreciate the work of both of your organizations, and I think I'm a sustaining member of the Junior League, and I'm a member of the Weber Heritage Foundation too, so I'm representing here.
Thank you.
Chair, maybe the mayor could help out in placing this monument or this marker. Maybe give him a few minutes to see if there's anything we can do.
I appreciate that, council member. I've made my notes, and we'll go to work on it. I don't know where the roadblock is, but we can figure that out.
Awesome. Thank you. There's even a pole-sized hole in the bricks right there, right at the right spot. We just need to get the pole in it.
We could probably make one, but let me work with engineering to figure out where the roadblock is. So I made a note, and we're happy to look at it.
Thank you.
But while I've got the mic, I'll just say we really appreciate everything that you guys all do, and this is a great honor for us to put forward. So thank you for being here, and thank you for everything that you do. Being the father of daughters, that matters a lot.
Thank you.
I just wanted to show you my playing cards that I have as well. So, oh, look at that Junior League right there.
Okay. Thank you both for being here tonight, and we'll get those out to each of those organizations so they can have those and display those. Next is public comments. Just a couple side notes. Questions posed during public comment will be noted and answered at the end of all public comments. If the council has the answers to the questions, the council will respond to those questions. For questions that relate to the administrative matters, the mayor may choose to respond to those during his comment period. Questions for the council administration can always be sent to citycouncil@ogdencity.com. The time is now yours. This is an opportunity to address the council regarding concerns or ideas on any topic. Before we begin that, I think we'll have Eric go ahead and just share how that will take place.
Yeah, thank you, Chair. For those of you who'd like to participate in the public comment portion of tonight's meeting, you must be joining us via Zoom, and you can raise your hand by using the raise hand feature on the bottom of your Zoom application. And for those of you joining us via telephone, you can raise your hand by dialing *9.
Thank you. Okay, looks like we have some hands raised. So first up is Heath Sato. Go ahead, Heath. The time is now yours.
Hi, Heath Sato, Ogden resident. This month I would like to say I'm really looking forward to the day we have our first female mayor in this town. So last city council meeting, I asked for the appraisal that was used to determine the selling price of the Brown Ice Cream Building, and Janine Eller-Smith was very helpful with getting that to me right away. I appreciate that. My concerns tonight are about the city's actions, not the buyer or his broker. You, the city council, approved the sale, but it appears the administration may have misled you about some of the details. So I want to go over that. What was sent to me was not an appraisal at all. It was a broker's estimate. According to the administration, was brought to the city by the buyer. The December 10th, 2019 RDA presentation told you that the buyer, quote, provided a commercial property estimate of value similar to a formal appraisal. And anyone in real estate will tell you that an estimate from a buyer's broker is nothing close to a formal appraisal from an unbiased appraiser. The price that the city accepted was based upon an estimated value per square foot times 5808 square feet. That size seemed entirely wrong to me, so I went down and spent 10 minutes measuring the building myself. The first floor alone is at least 5808 square feet. The second floor is about 4,500 square feet. Really ugly buildings further down the street are selling for $120 to $200 a square foot these days. But even at the low valuation of $55.50 per square foot that the buyer's broker supplied, that upper floor is worth over $250,000, but was not included in the price. Brandon Cooper told you in December 2019 that the city enlisted a commercial real estate broker to list the building for sale and that the buyer made an offer within a month. I cannot find where this building was ever listed on the MLS or even LoopNet. First place a broker would typically list commercial property. Was it actually listed anywhere? So, I would love to go to a car dealership, tell them what my friends say I should pay for a certain car, then pay exactly that amount without any debate, regardless of how wildly wrong that price is. But that's not how things work in the real world. I just want to know if the property we taxpayers own as a city is being sold using any system beyond just trust whatever the administration says. I don't have enough information yet to say how this happened, but neither of the options I can imagine are acceptable. I need your help in figuring this out. So my questions are, 1, was an actual unbiased appraisal ever made by an independent appraiser on this property? If not, why not? 2, who determined the square footage used to decide the building's value? 3, who was the city's broker? Where was this public property ever listed publicly? And how many offers were made? Just before the meeting tonight, I sent you all a copy of these 3 questions for your review. Thank you for whatever answers you can provide tonight, and I'll see you next week.
Thank you, Heath. Okay. Next up, we have David Timmerman. Go ahead, David. The time is now yours.
Thank you. Can you hear me okay?
Yes, thank you.
Thanks for your time tonight. Just a question I think I've raised before, but I just want to be clear about this. I'd like to know, what is the process to begin or to request a new committee in the Ogden City Council or Ogden City per se for a Justice and Police Reform Committee. I'm really interested in participating or at least helping and establish such a committee. I think we have a lot of committees already, but I do think that the time is right to address these important issues as to what we do, how we deploy our police, and what responsibilities they have to us as a community. In reference to the things you're going to discuss in your closed session tonight, section F and G are important to me relative to deploying security personnel and using updated crime detection techniques. Ogden City has a real-time crime center, which I think can be a boon to the community, but I am concerned that we do not have any kind of guardrails limiting the activity of that group. And anytime when there's a lack of supervision or specific guidelines, we can end up with a serious issue regarding constitutional rights violations by our gentlemen in blue and gentlewomen in blue, which I support strongly. I feel like this is the 21st century. We have these new systems available, but I think it's important that we continue to monitor the activity and to record the activity so that we're following things by the book, that we are not violating our citizens' constitutional rights. At the same time, we are trying to apprehend the bad guys per se. Sometimes I think it's important that we take a look at these things and we see what exactly is the point. What are we doing? Is this the best expenditure of our dollar? And is there enough supervision to ensure we're doing the right thing? And then finally, on the last section, I think it's section G, relative to termination of employment or investigations to personnel. I just want to remind everybody that South Ogden City recently had an officer who was involved in a fatal shooting, probably accidentally. And that man was not disciplined. He took his Fifth Amendment rights and was back in service, still works as far as I know for them, and probably should have been terminated due to his lack of cooperation to the investigation. Thank you very much.
Thank you, David. Next up, we have Kevin Lundell. Go ahead, Kevin. The time is now yours.
Hey, everybody. Kevin Lundell, Ogden City resident here. So I'm a bit out of breath. I'm actually currently coaching a CrossFit class right next door. But was listening to the podcast of the work session last week. Big shout out to those who make the podcast happen. It definitely makes it possible for people like me to be able to listen. I had a few questions regarding fees with utility bills and new software, I believe, that's taking place there. I didn't quite understand all of that. But first question is, after polling 4 of my friends recently this week about whether they get late fees or whether they have late payments on their water bills, all of them said yes. And that is because it is very difficult. I believe you can set up an auto pay, but you have to take a voided check in, and it's very difficult to set up auto pay. Most of all of our bills are on auto pay. And so I was wondering if the new system is going to make it easy and accessible for us to have it on auto pay, so we don't have to find that bill in our email that comes on varying days to avoid paying late, making it much easier on residents here. Other questions I had were in regards to late fees that are going to be taking place. I guess I kind of wonder, I understand, I heard the argument that we're kind of going up to industry standard, but I kind of wonder why. I mean, in the own report of this from the city, it said that they don't expect any sort of revenue increase due to these late fees. But late fees, we know for many people who pay late can be really detrimental, particularly if we from what I understand, if you get 3 late payments in a 12-month period, there's going to be a deposit assessed. The deposit is supposed to make up for 3 future payments, which could be upwards of $300. You know, spread out over 3 months, effectively doubling someone's water bill for 3 months. To someone on a fixed income, that could be really, really devastating. And I just wonder if we're thinking through all the unintended consequences. You know, this could be someone that ends up having to get a payday loan to get their water on and running, so that they can pay that deposit, so they can go forward. So I really think we need to think about who this harms, and is the system currently really broken? I understand, you know, the fee for having somebody come out and put a door hanger on, totally get it. Covering costs, totally get it. But is the system really broken? And do we really need to assess fees, which could very likely apply to our most vulnerable among us and put them in really difficult financial situations just to have their water? So would just like to know and consider those things as you're going to be voting on that in the future. Thank you.
Thank you, Kevin. Okay, next up we have Angel Castillo. Go ahead. Go ahead, Angel. The time is now yours.
Thank you. Good evening, council members, Angel Castillo, Ogden residents. And I'm going to talk to you about something that I've been talking to you about since 2018, and that's the discussion about housing affordability. And in October of 2020, y'all had a discussion about affordability in a work session. And council members Nadolski, Chaburka, and Whitehall acknowledged there was a problem with affordability in Ogden, and there was dissent about that. And Councilmember White suggested looking into studying just exactly what that means for Ogden. And when I say Ogden, I mean Ogden, not Ogden Clearfield Metro, which has 700,000 people and an average median income that's 30,000 higher than Ogden. And I know that Councilmember White has spoken to Dr. Jenny Nagy, and Dr. Jenny Nagy has verified that Ogden has a shortage of 2,205 affordable rental units and a shortage of 3,160 affordable and available rental units. And available means that there are people renting possibly lower monthly rent payments that don't necessarily need to be in there. Their incomes don't match that. So that brings me back to the question, what are you going to do about it? Councilmember Nadolski said emphatically in that October meeting, it's like, well, do we have a problem? Wait. What we're dealing with, and you have an asset with Dr. Nagy, and she has the availability to give you current information. And the first step in solving a problem is realizing that there is one, and a plan has tangible goals and measurements for that goal. And this morning, Mayor Caldwell participated in a press conference, and Governor Cox flat out said all of Utah has a problem. And Mayor Caldwell has been on record stating that we have a surplus of affordable housing, and that's based on Ogden Clearfield Metro data, which is not what we deal with as citizens of Ogden. So I really want to know what you're going to do about it, because we do a lot of talking about stuff, but there's no actual plan. And an actual plan meaning a mixed income development plan of different types of housing and how we are going to increase this availability. And you know, we have the Own in Ogden program is amazing. And Tom Christophilus, it's a great thing. And we need more money into that, but that's not going to solve our problem. We have a inventory issue. And we need to be looking at what areas can take density, what kind of density that may look like. Is it single family homes? Is it ADUs? Is it apartment complexes on transit lines? But we need to decide whether or not there is a problem. And here's the spoiler. We do have a problem. And if you don't believe me, I'm hopeful that you'll listen to Governor Cox and start doing something to start solving this problem. Thank you.
Thank you, Angel. Okay. I believe that is all of our callers with raised hands. Okay. There were some questions raised by the public. If any council members has answers or would like to address that, we can do that now. If not, we can move on to comments from the mayor and administration. Seeing none.
I mean, I'd be happy to comment on a couple things I know about.
Okay.
I don't know if I've got all the up-to-date, accurate information on everything, but first to the point that David brought up, which he has brought up before about the advisory committee, or called it a Justice and Police Reform Committee. I know that we've had some discussions about that before, and there's some legislation happening right now around those issues too. So that might be something. I could look that up, David, and let you know what the state regulations are around those kinds of bodies. And then, kind of speaking with the administration, we've just talked about how those have limitations, and I believe they are meeting with a group regularly to talk about some of those things, but I can let them speak for themselves. And then I just wanted to let Kevin know we actually did have a conversation on the weekend about this too, so you might hear some of my thoughts, and his thoughts are very similar. Kevin, I just wanted to let you know, in the work session, we actually determined to pull that consent agenda item off of the agenda today because we wanted to explore those issues a little bit more. And then Vice Chair White also had some concerns with that piece. So we're going to put that off for a couple weeks and work on it, and then you'll see it come back up.
Okay. Thank you, Councilmember Chaburka.
Eric, I just want to, I guess maybe it's the mayor did we skip over the mayor?
Well, after I was just letting, if any council member had question or answers to the comments that were raised. If not, we'll go to the mayor.
Yeah, this is directly in regards to the housing. I do know that our administration and council staff, probably, I don't know, my time's getting away from me. 4 to 6 weeks ago, I had sent a list of items that a city could do from a policy perspective, and I know that administration is working through those and seeing which policies that we do and do not have. I also know that from a state level, which I think is, speaking of Governor Cox, I think the state SB 34 that was introduced a couple of years ago is also being not revamped, but where the state is increasing the number of items that a city has to follow in order to get funding for transportation. So I just wanted, it is not sitting on deaf ears, and we are not sitting here not doing things. I guess that's to a lot of double negatives, but we are working through the housing. It's just not, doesn't seem like it's happening fast, but we have to make sure that the rest of, speaking of the MSA, we need to make sure that the other cities are pulling their weight. And so that's part of the reason why Weber County is working on this. And so there's a lot going into housing, including funding for around, transportation areas. So I just want you to know that the puzzle pieces are coming together. It just doesn't seem like it is all happening at the same time.
Thank you, Vice Chair White. Okay, if no other comments, yeah. Any comments from the mayor?
Sure. I just add part of the reason Governor Cox came up today and had that press conference is because we've been so aggressive in addressing all of these issues. And we've been more aggressive than almost any other city along the Wasatch Front. And I appreciated him pointing out that the Milken Institute put the report out that said we were the 9th best, one of the top 10 best performing cities in the entire United States. And so we're looking at all of these things. As part of the reason I spent a lot of time working with the Utah League of Cities and Towns and with the Wasatch Front Regional Council, because we want to be on the leading edge of these things, and we are. And sometimes it takes time, and sometimes that gets frustrating, but everybody needs to know that's our commitment, to be on the leading edge of some of these things. And accusations that we're not talking about this every day in department director meetings with our CED group and everything else, those are just patently false. And that's not fair at all. Those guys do a tremendous amount of work trying to figure this out. And there's not a single community in the United States that has the master plan that can take care of all of it. And so I really want to just shout out to our CED group and our department directors that have worked so hard on this. And I'm really proud of the work that they've done. To be in the top 10 performing cities in the United States is something when I grew up in Ogden, that was not something that was even talked about or even thought about. So I'm proud of where we're at, and we'll continue to work and we'll continue to listen. I've listened to everybody talking about the mixed income plans and police reform and everything else. And you need to know that we're deeply embedded in those conversations in our community and on the state level. And so I appreciate everybody being willing to log in and talk about that. That's stuff we're listening to, and that's stuff that we're working on. So thank you, and know that we'll continue to be advocates for those conversations.
Thank you, Mayor. Okay, comments from council members. Seeing none, I would take a motion to adjourn.
Motion to adjourn.
Second.
Thank you. We have a motion to adjourn by Council Member Heyer and a second by Vice Chair White. This is a voice vote. All in favor?
Aye.
Aye. Any opposed? That passes. And then stick around. We have one other meeting after this. If you'll just let us know when we're good to go, Eric.
We are good to go.
Perfect. Thank you. Okay. Good evening and welcome to the Special Redevelopment Agency meeting for Tuesday, February 23rd, 2021. Let the roll call reflect that all board members are present. Just as point of reference, we have read the council chair determination to hold electronic meetings without an anchor location at an earlier meeting. And so we just wanted to make that known and that has been read and is on the record. The first item of business is the consideration of adjourning into a closed executive session.
Chair, I'll move that we adjourn into a closed executive session for one of the 7 items listed in the agenda.
Second.
Thank you. We have a motion by Board Member Heyer to adjourn into a closed executive session and a second by Vice Chair White. This is a roll call vote.
Board Member Chaburka?
Aye.
Board Member Heyer?
Aye.
Board Member Lopez?
Aye.
Board Member Nadolski?
Aye.
Board Member Stevens?
Aye.
And Vice Chair White?
Aye.
Chair Blair?
Aye. That passes. And we will go ahead and adjourn the meeting from the closed executive session. So thank you.